Hi, my name is Cheyenne Thomas, and I'm a nursing student. And today I'm going to be conducting a head-to-toe assessment on you.
Okay.
Before I begin, can I have you just verify your name and your date of birth for me?
Mary Smith, 7/29/70.
Perfect. Thank you, Mary. And then I'm just going to ask a few more questions real quick. Where are you at?
Reno,
And what year is it?
or 2020.
Good job. And who's our president?
President Trump.
Good. And then what's the virus going around right now?
COVID-19.
Good job. Thank you so much. So general appearance, patient is overall alert and oriented ×4. She's sitting in an upright position. She has no obvious signs of respiratory distress or pain. She's not sitting in a tripod position or anything. She has good pigmentation. It's even throughout. Like I said, she has no obvious facial drooping or anything like that. And so we're going to go ahead and move on to our subjective questioning. So to begin, I'm going to ask you just a bunch of questions that kind of pertain to all areas of your body. So if you think of anything that you've noticed lately, go ahead and just let me know. I'm going to ask about some specific things. Answer to the best of your ability. Have you noticed any recent changes in your hair, in your skin, or any moles, like anything like that?
I have not.
Good. Do you wear sunscreen when you go outside?
I do.
Oh, good job. What SPF?
Anywhere between 50 and 70.
Good. That's good.
Yeah.
So, great. Another question I have is, have you noticed any blurry vision or changes in your vision lately?
No.
Do you wear glasses?
I do.
For reading, for driving, or all?
All of the above.
Okay, good. Now, do you have like a sense of dry mouth or any dental pain or anything like that today?
I don't.
Okay. Any muscle pain or fatigue that you've noticed lately?
No.
Okay. Have you noticed any chest pain or palpitations, like you can feel your heart beating excessively lately?
No.
Good. Okay. What about breathing? Have you had any shortness of breath or a cough?
No.
No? Good. What about with fatigue? Do you notice like abnormal shortness of breath?
No.
Okay. Do you work out often? Do you go for walks, gardening, anything like that?
Gardening, yes. Walking, a little bit.
Okay, good. That is important to help us keep moving. Other than that, have you noticed any numbness or tingling in your arms or your legs?
No.
Good. Do you have any family history of MS or any other neurological disorder or disease?
No.
Okay. Do you have family history of diabetes?
My maternal grandmother.
Okay, and then have you ever been tested or have you been found positive for diabetes?
No, I haven't been found positive, but yes, been tested.
Okay,
Just
good.
blood work.
Yeah, checking that blood glucose.
Yeah.
Okay. Good. Do you smoke anything?
No.
Okay, what about drink alcohol?
No.
Good job. Recreational drugs, do you use any of those?
No.
Okay. Those are helping us just to determine some risk factors and things like that. I'm trying to think if there's anything else. Are you in any pain anywhere today?
I'm not.
Good. That's great news. So we're going to be doing our exam, and it'll involve me looking with a pen light at some different things, touching with my hands down your extremities, touching your hair, different things like that, and then also using my stethoscope on your chest, your back, and your abdomen. And then we'll also be testing some range of motion. So at any point, if you're uncomfortable or if you're in pain, please just let me know.
Okay.
Okay, so to begin, I'm just going to go ahead and start by looking at, overall your skin. And so if you don't mind, I'm just going to take your arms. Good. And then go ahead and set them down. Do you mind if I touch your hair or anything?
I don't mind.
Any tenderness on your head?
Nope.
Okay, good. What about your neck?
Nope.
Good. So hair is evenly pigmented and evenly distributed throughout. There's no signs of infestation and no signs of occiput breakdown or anything like that. Skin looks evenly pigmented throughout. There's no signs of irregular moles or lesions at all. So that's all good. I'm going to grab my pen light. And I'm going to start by looking at your eyes. So I'm going to go ahead and shine the light in your eyes, look for the pupil to react.
Okay.
Just given on observation, her sclera is white. There's no jaundice or no redness to it or erythema. Her eyes are symmetrical. There's no drooping in them or anything like that. Now we're going to use the pen light and just test that. So just look straight at me. Sorry, I know that's hard. So pupils are round and equal and reactive to light. They are both voluntarily and involuntarily dilating and constricting appropriately, so that's good. Sorry, I know that's a rough time. The next thing I'm going to do is look at your mouth. So just by looking at the lips, they are symmetrical, they're even, and they look decently moist, well perfused. They are pink. So I'm going to have you open your mouth, and I'm going to use the light to look in at your mouth. Can I have you say ah? Good job. Okay, good job. So the mouth mucous membrane is pink and moist. Her uvula raises appropriately. Her tongue is pink as well, and you can see some papilla, which is normal and expected. Her dentition is normal. There's no missing teeth or anything like that, so that's all good. Her tonsils are 2+, which is normal. The next thing I'm going to have you do is just raise your eyebrows for me. Good job. And then can I have you puff your cheeks out like a puffer fish? Good. Can you stick your tongue out? Good. And then just smile real big for me. And then frown. Well done. So that was testing our cranial nerve 7, which is our facial nerve. And there's no deficit there. She has equal lifting of the face. There's no drooping, anything like that. So that's all good and normal. The next thing we're going to do is I'm going to go ahead and feel down your arms for, like I said, tenderness. If it hurts or it just feels uncomfortable, just go ahead and let me know.
Okay.
I'm going to be looking for warmth, and then I'll push a little bit for some edema.
Okay.
Let me get down. Does that hurt at all?
No.
Okay. Skin is warm and dry, and the temperature is even throughout in the upper extremities. There's no tenderness upon palpation. Next thing I'm going to have you do is I'm going to have you flip your hands, and I'm going to take your radial pulses, okay?
Okay.
I'm just going to feel here. All right, good. So radial pulses are 2+ equal strong, and they're bilaterally the same. I'm going to go ahead and push just a little bit. There's no edema present, so 0 hitting edema, so that's good. I'm going to do the same thing to your legs, okay? So I'm just going to go ahead and feel down. Any tenderness?
No.
So no tenderness upon palpation. Again, the temperature is even throughout. Her feet are slightly cooler, but not in an overwhelming or concerning manner. Do you notice that often, that you have cold feet?
I always have cold feet.
Yeah, that's expected a lot of the times. So I am going to check your dorsalis pedis pulse.
Okay.
So that's going to be on your foot here, and it might take me a minute. So I'm sorry, I'm going to try not to tickle you.
Oh, it's all right. I'm not that ticklish.
So the pulse is a little bit weaker than the radial, which is to be expected, but it is still 2+, and it's equal bilaterally, so that's good. I'm going to go ahead and push on your shins to look for edema, okay?
Okay.
And there's no edema present there either, so that's all good. I'm going to go ahead and push just a little bit more on your toes. Good, and then push on your fingers here. And capillary refill is less than 2 seconds both in the upper and lower extremities, so that's good. Next thing I'm going to do is just check your chest for tenderness, so I'm going to push just a little bit on it. Is that okay?
Mm-hmm.
All right. Is there any tenderness when I do that?
No.
So there's no tenderness to palpation of the chest. The AP to transverse diameter is 2 to 1, which is normal. That's expected. So that's a good thing. The next thing I'm going to do is grab my stethoscope and listen to your heart.
Okay.
So I have to listen in 5 spots. Your aortic, pulmonic, Erb's point, tricuspid, and mitral valve. I am going to have to go under your shirt. Is that okay?
Yes.
Okay. Thank you. I'm going to be explaining a lot of stuff while I do this, so if you have questions, just let me know.
Okay.
I'm going to start at the aortic, which is the right sternal border second clavicular space. So that's going to be, I'm just going to feel. Okay. So this is the aortic, and S2 is heard greater than S1, which is totally normal and expected. I'm going to move over to the pulmonic, which is the left sternal border second clavicular space. Same, S2 is heard greater than S1. I'm going to move down to the third clavicular space. This is going to be our Erb's point. And S2 and S1 are heard equal. Next is going to be your fourth clavicular space, left sternal border, and this is your tricuspid valve.
Okay.
So like I said, I'm just going to move down slowly. If you're uncomfortable, just let me know. Good. And that's S1 is heard greater than S2, which is normal. I'm going to come down to your side, and I'm going to go to your fifth clavicular space. For women, it's a little bit harder, so I'm going to come just to the side here. And if you don't mind, I'm going to come underneath your bra strap. Sorry, my hands are a little bit cold.
It's okay.
Good. And that's your mitral valve, and S1 is heard greater than S2 also. That's totally expected. It was regular rate and rhythm. There's no murmur present, no extra heart sound, which is good. So the next thing I'm going to do is go ahead and listen to your lungs. So again, I'm going to have to be inside your shirt, and then I'm going to test the back as well. Okay. So I'm going to be listening to 6 places on the front and 8 places in the back.
Okay.
Okay. So I'm just going to come right here. It's going to be close to your sternum, kind of.
Okay.
I'm just going to come here and go ahead and take a deep breath. Good. And the other side. Well done. Good. Good. Go down a little bit lower. Go ahead. Good. Great. So anteriorly, the lungs are clear to auscultation. There's no crackles, wheezes, rhonchi, or rales, so that's all good. Breathing is unlabored. There's no accessory muscle use with that, and no dyspnea. So now I'm going to have you can I have you turn this direction? Just like that. Actually, I'm going to have you turn the other way. Sorry. Okay. Then I'm going to come here. I'm going to listen in your back, and we do have to listen in 8 spots. So if you need a break, please let me know. We don't want you to get to feel lightheaded or anything.
Okay.
Okay. And just every time I move the stethoscope, go ahead and take a deep breath. I'm going to come down in here. Good. Okay, and then I'm going to go down just a little bit further. Good, well done. So the posterior lungs are clear to auscultation, both the right and left lobes are good. There's no rhonchi, rales, wheezing, crackles, anything like that. So that's all good and normal. I'm going to go ahead and put this back. The next thing I'm going to have you do is lay back for me. I'm going to go ahead and test the abdominal different things. So what we're going to do first is just inspect, and then I'm going to auscultate, and then I'm going to go ahead and palpate. So if you don't mind me just lifting your shirt slightly. Okay, good. So there's no distension, there's no erythema or anything like that. The abdomen looks normal. We're going to go ahead and auscultate, like I said, in all 4 quadrants first. I'm listening just for bowel sounds. Try to make sure it's nice and warm for you so you don't have anything else. We're going to go ahead and look. Your umbilicus is midline, so that's to your belly button all the way up. Okay. And that's going to kind of guide our 4 quadrants. So we have our right lower quadrant, which is right down here. I'm going to go ahead and listen now.
Okay.
This is typically the most active sound. Okay, I'm going to move up to the right upper quadrant, which is going to be just up here. Good, moving to the left upper quadrant. Good, and then the left lower quadrant. Good. So vowel sounds are normal active. There's no issues with that, so that's good. The next thing I'm going to do is listen to your arteries. So your aortic, your iliac, and then your renal arteries. And it's just going to be in similar spaces for that. We'll start up in your midline, then we'll move down, and then move down just a little bit further.
Okay.
For this, we're listening for a thing called bruit, which is like a whooshing noise. And that's just showing that like the blood is having a difficult time going through. So we're going to start up here at your iliac, or your aortic, sorry. And that's right here, midline kind of. Okay, going to move down to your iliac. Good, move over to the other side. Okay, and then to your renal. Other side. Alright, good. So that's, no bruit was noted, just heard the normal active vowel sounds, which is a normal finding. So next I'm going to go ahead and move on to palpation. And so let me know if anything hurts at any point, okay? I'm going to go ahead and just start with light palpation. Any tenderness in that?
Mm-hmm.
What about when I let go?
Nope.
No? Okay. No tenderness?
No.
Good. So then I'm going to go ahead and move on just a little bit deeper, okay?
Okay.
Any tenderness with that?
Mm-hmm.
Okay. Sorry. Any tenderness?
Ticklish.
Ticklish. Okay, I'll try to be a little bit more firm. No tenderness anywhere?
Mm-hmm.
All right, great. I can have you go ahead and sit up now.
Sorry.
Good job.
My feet aren't the ticklish.
It's your sides.
Yes.
Well, so there's no tenderness upon palpation. There was no masses or hernias felt. There was also no rebound tenderness, which is good, important in appendicitis especially.
Okay.
So now I'm going to go ahead and move on to just your range of motion.
Okay.
So how I'm going to do that is just have you test your upper and lower extremities. So
Okay.
can I have you put them out? We're going to have extension here. Good. And then can I have you flex them like you're doing a curl? Good. So full range of motion, 5 out of 5 with that. Next, can I have you do the interior or external rotation and then internal rotation? Good. Any pain with that?
Mm-mm.
All right, good. So that was full range of motion, 5 out of 5 for the upper extremities. Similarly, I'm going to have you just kick your legs all the way out.
Oh, both at a time?
You can do one at a time. That's totally
Okay.
fine. Good. And then other one. Good. And then can I have you bring your knee outward? Good. And back in. And outward. And back in. Good. So when you brought it out, that was extension.
Mm-hmm.
When you bring it back in, that's just flexion. Outward is the external rotation, and then inward, internal rotation.
Okay.
So lower extremities, 5 out of 5 range of motion. The next thing, I'm going to test your strength. And so I'm going to test your upper extremities and your lower extremities. So I'm going to test your flexion by pushing down, and I want you to try to flex your arms, okay?
Okay. Like
So,
that?
yep. So you're going to try to flex, I'm going to try to push down.
Okay.
Ready? 1, 2, 3. Good. And then opposite, I'm going to try to push up, you're going to try to push down. 1, 2, 3. Good. So 5 out of 5 strength with flexion and extension of upper extremities. I'm going to do the same thing with your legs here.
Okay.
So I'm going to have you try to push up, and I'm going to push down. Okay?
Okay.
1, 2, 3. Good. And then opposite, I'm going to have you try to push backwards, and I'm going to push up. 1, 2, 3. Good. And then same thing with this one. So first one is go ahead and try to push backwards. 1, 2, 3. Good. And now I'm going to have you try to push forwards, and I'm going to push back. 1, 2, 3. Good. So 5 out of 5 strength in the lower extremities as well. Now I'm going to test the same thing with your feet. So I'm going to have you try to lift your feet up towards the sky, and I'm going to push them down, both at the same time here. Go ahead. Good. And then I'm going to have you push on the gas. So lift them up, and go ahead, push on the gas. Good. 5 out of 5 strength in the feet as well. And then the last thing I'm going to have you do is just go ahead and pull on my, squeeze my fingers. Yep, squeeze as tight as you can. Good. So 5 out of 5 strength in the hand. It is equal and symmetrical bilaterally, so that's really important. And that was the same for upper, lower, hands, and feet. So that's all good and normal. Do you have any questions for me?
I don't.
You did great.